go through everybody, but if we have time at the end, we could get you to match the picture to the name. So again, similarly to everybody else, really, we were a bit disappointed with our MPDA and PREMS results, so in particular with being a negative outlier for the HbA1c and some of our PREMS results. So looking at that, we really thought to try and get on top of both of those, we want to really look at sort of engaging our children and young people more and ultimately empower them towards more decision making and self-management. So we've been quite a big team, we had quite a lot of ideas, so then we sort of tried to focus them into 3 different streams. So looking at downloads, first year from diagnosis and clinic experience. And to start off with, we decided we needed a whiteboard. This is our major achievement of our whiteboard, and some would also say this is when the rest of the teams really started to have concerns about their choice of QI champion. And this is sort of how we've used it just to do our initial sort of brainstorming and our initial process mapping, which is not the definitive. And we know there's a lot more stages, and there are some fishbone diagrams on the back of that you obviously can't see. So thinking about downloads, so we initially looked at where we're at now at the start, and I think we actually benefited from COVID. So we were actually quite pleased to see that 77% are able to or have downloaded at some point, which is higher than we thought. But I think COVID has really pushed that. People obviously very bored, so happy to try downloading. But of those, only 46 are downloading regularly. And then when we've looked at this before, those downloading regularly, less than 50% are actually confident in making independent changes. So that's what we wanted to really work on. And so we've already looked at piloting this sort of educational tool for our children and young people. So this one's just relating to DIASEND, but we're going to roll it out for different versions of different technologies. But really, we've piloted that just to check with our children and young people that it is readable and usable, and we've had good feedback. So we're now rolling that out to a wider group. The first year from diagnosis. So you can see there, we've just looked at our 2019 to 20 new patient cohort, and you can see that sadly their HbA1c is sort of taken off at the sort of 3, 6 and 9 month mark. So we're really reviewing our sort of workbook to maintain that sort of intensity for really the first 12 months, but more importantly, looking at checking our effectiveness of that education. So working in exercises to assess their knowledge along the way and also our effectiveness of teaching. We are now looking at getting more downloading from diagnosis and also pointing in the direction of other educational resources such as DigiBeat. And then thinking about our clinic experience. So again, the PREMS, these are the areas that we scored, say, less well in. And that was related to the actual clinic environment, but also the clinic discussion itself. So we've had a lot of thoughts about looking at those different areas and making things a bit more pleasant, child or age appropriate sort of waiting areas and materials, even just having posters up to let them know who's available in terms of the team, and having very visual measures of the information we're talking about. And similarly to Scarborough, thinking a bit about the terminology and maybe focusing less on HbA1c, but more on timing range, average blood sugars, and also questionnaires like this at the bottom around what they want to talk about. So it's felt a bit more child and young person led. So team working, so we're managing to meet weekly, remotely, and we're alternating days so that everyone can attend, and I think that's going well. I hope the others would agree with me in terms of better working together and just catching up with each other in the current COVID climate. I think by doing this, we always had these sorts of ideas and things we wanted to achieve, but this has just given us more momentum as well, keeping us to sort of timelines, keeping us to task. We're also involving our children, young people and families. So for example, we've already piloted that educational tool. We're getting them to try and come up with our DigiBeat clinic name, getting them involved in more surveys and interviews for team members, and also involving the wider organisation, such exploring sort of alternative clinic space, involving the Trust QI team by accident actually, but they've been really helpful. And then learning so far. So yes, it does need to be the whole team involved, and I think particularly by splitting into the 3 streams with a big team, which actually means that everyone can get involved in an area they're interested in, so everyone's got some ownership. I think we mentioned before about the importance of real-time evaluation as we go along and not just at the end, so that we know what we're doing is making a difference or that we're not wasting time or not negatively impacting something else, so that we keep an eye on that, and not just our sort of outcome measures, but the sort of the process measures, as it were. And as we've been saying all along, small sort of achievable targets.